Hello and welcome. This video is about diabetic complications and their treatment with integrated medicine. We will focus on pathologies where conventional medicine often fails to achieve long-term satisfactory improvement. Our case study is a lady in her 70s with type 1 diabetes, recurrent infections of the second toe on her left foot, and diabetic retinopathy with moderate vision loss. What happened in the background? High blood sugar thickens the blood. Microcirculation slows down. Sludging blocks flow exactly where the body needs it most. One can easily check blood thickness by taking a selfie of the veins under the tongue. If these veins appear thick and bulging, the blood is likely thick as well. When capillary circulation fails, it cannot deliver nutrients effectively. Mitochondria starve. When mitochondria starve, they cannot generate energy and waste products build up. This waste triggers inflammation, causing tissues to swell. The swelling further blocks blood flow, worsening the problem. Nerves and eyes depend on tiny vessels called capillaries and high energy mitochondria to maintain vision and sensation, both of which rely on electricity and energy. They are the first to break down when the body's field collapses due to circulatory blocks. While this process occurs throughout the body, it becomes most apparent first in the eyes and neural tissue for these reasons. When damage begins, cells lock down by building in saturated fatty acids into their membranes. Membranes become rigid, blood thickens, and chaotic inflammation spreads within the tissues. When blood flow is blocked, antibiotics cannot fully reach the infected tissues. Infection hides and never fully heals. Infection is always a sign of energy deficiency. While antibiotics are essential, they are cold in nature. They cool both pathological and healthy processes, which may further reduce energy production and hinder healthy recovery. Once antibiotics are stopped, high blood sugar continues to hinder healing. This is where herbs can support the process. A classical herbal antibiotic formula supports this situation by working alongside synthetic antibiotics. It not only cools inflammation, but also improves blood circulation in the capillaries, supports mitochondria, and enhances healthy energy generation. Used together with antibiotics, these herbs help push blood and oxygen into the tissues, preventing necrosis and tissue death. Necrosis and cell death can occur in the toes and in the eyes. Neuropathy and retinopathy share the same root. Capillaries leak, mitochondria fail, and signals disappear. Synthetic antibiotics used together with the herbal formula may address these challenges more effectively. Importantly, herbal antibiotic formulas are used not only for a few days. Afterwards, a milder formula is introduced to stabilize the underlying diabetic condition by supporting mitochondrial function, waste removal, and membrane stability. Herbal antibiotic formulas may speed up wound healing by improving blood flow and helping synthetic antibiotics reach infected tissues. The affected limb should begin to warm up. If the limb remains cold, wounds heal slowly, vision worsens, or infection occur, the field remains blocked, and the body needs more than sugar control alone. Because this formula improves circulation, minor bleeding may occur. If this happens, the formula should be paused and restarted at a lower dose. The key lessons are: keep the blood moving and keep the field open. Recurrent infections and conditions like diabetes, kidney or liver failure often require more than antibiotics alone to prevent recurrence and achieve long-term improvement. The photos shown were taken on day 0 and on day 2 of treatment. Follow-up reports showed no recurrence of the toe infection, and the patient's eye checkup noted improved vision. Subscribe for more field medicine perspectives.